This year, I am celebrating the anniversary of my invention, the AMI 750. In a new series of 10 short videos, I will share my journey of combining ancient healing techniques with advanced sound technology. In a vision, I was shown how therapeutic sound could benefit the human form through a whole new way of communicating with the body. In the last decade, many sound discoveries have been made. I want to share with you how specific sound frequencies can bring resonant health. I believe the story of my experiences will help you understand how everyone can have access to the frequency patterns which speak to the innate intelligence of the body. Just after the AMI 750 had been launched and made available to the public, I learned about the prestigious Thomas Edison Award. I was excited to discover that there was a category for entries in the fields of science and medicine. I was very impressed when I read the criterion. I had also been excited and pleased by the initial reviews of the AMI 750 after its launch in Atlanta. Shortly after, someone from the Thomas Edison Committee contacted me with an invitation to submit the application to become a nominee. The award would be a truly exciting accomplishment, especially for a new product. In the true spirit of Thomas Edison, the adjudicators were looking for products and innovations that address a need, solve a problem, or seize the opportunity to create a new market. I felt that the AMI 750 possessed all of these qualities. I couldn't help but think that Thomas Edison himself would have been interested in the possibilities of how therapeutic sound could change the world. I also believed that my own personal story could be an inspiration to other innovators. And I had learned how important it had been for me to trust my own vision and dreams for the future. I took all the necessary steps for the submission of the application. I understood the value of having a prestigious panel of judges who were experts from a wide variety of industries review my product. I also believed that winning the award had the potential to be greatly beneficial to my field of endeavor. Then came the waiting period. A short time later, I was notified that the AMI 750 had been chosen as a nominee. I truly enjoyed all the attention that was given to my product in the months that followed. Some weeks later, even when I learned that I didn't win the award, I remain very excited to have been included in the group of nominees. In the spirit of the works of Thomas Edison, I will continue to explore the many applications of therapeutic sound. I will continue to make contributions to the cause and purpose of innovation in the world, making sound therapy available to more people. I believe the AMI 750 will have a long-term impact on the medicine of the future. After the AMI 750 first came on the market, I became aware that some relatively new research had surfaced validating the meridian system. I had studied Chinese medicine and was a firm believer in these rivers of life that could carry healing information to the body, and in fact, the AMI 750 was designed to transmit sound in exactly that way. I was extremely interested in being able to show that these ancient tenets were an integral part in the success of my new device. I was delighted to find out that Dr. Joey Jones at the University of California, Irvine had conducted an experiment to show a correlation between an acupoint and the treatment of a corresponding eye disorder. Through the stimulation of the vision-related acupoints VA1 and VA8. The results were to be compared with the visual light stimulation study normally used in the fMRI of the visual cortex. The surprise was that the rate of the response in the brain from stimulating the acupoint on the foot was actually faster than the response from shining the light directly into the eye. Not only did this experiment prove that the meridian pathways exist, but that communication was happening between them and the brain at great speed. The release of this research was a great endorsement for the premise of delivering sound along the meridian pathways with the AMI 750. The research demonstrated incredibly the efficacy of using the acupoints on the feet. With the AMI 750, we weren't just shining a light on the acupoints, but we were accessing the body's healing along the meridian pathways through the portals at the bottoms of the feet. We were transmitting extensive vibrational healing, the information in the frequencies, in a brand new way that combined ancient healing practices with advanced sound technology. Admittedly, it is difficult to imagine that the whole body can be positively affected by transmitting energy through the soles of the feet. But we must also remember that the principles of the AMI 750 come from one of the oldest medical systems in the world, traditional Chinese medicine. It has taken incredible amounts of study to fine-tune the sound techniques we are now able to use with the AMI 750. As CEO of Cyma Technologies, I am happy to say that we are dedicated to producing the most fully researched and perfected sound therapy protocols for use now and into the future. As our knowledge base grows, so will the healing power of sound. Since 2005, when I spoke to Dr. Manners and he decided not to accept my invitation to visit the United States, I had been left with his words, "No, my work is done. It is your turn now." My years between 2001 and 2016 were devoted to researching the ways to most successfully utilize the work he had given me. I began collaborations with researchers, speaking with engineers, and collecting data from the early cymotherapy practitioners. Their collective knowledge and experiences were showing me how to evolve the frequencies into the next level of highly effective protocols. I had known from the beginning that we needed to develop Dr. Manners' body of research into something that could be more effective in our modern times. But I was also looking into the future to see how we might meet the ever-changing health needs of an evolving human race. Even though Dr. Manners gave me the 750 commutations to work with, there was no published research, at least not of a standard that would be acceptable in the U.S. The burden of proof as to how this form of sound therapy worked was passed to me. This required me to go down many avenues to find answers. The very first cymatic therapy instruments had an applicator that could apply sound transdermally to one area of the body only. If the client had more than one problem area, it became very time-consuming and limited the number of people a practitioner could help in one day. With the knowledge I had from studying ancient medical systems, I knew it was possible to communicate with multiple layers of the human being. I believed that this was a more efficient way to address the causes of disease, along with the symptoms that manifest with them. My studies of traditional Chinese medicine had shown me ways of accessing the healing energy of the body through the portals of the feet and hands. This required a reorganization of the codes Dr. Manners had given me. When I began to see the promising results of using the AMI 750 device, I knew that there could be an evolution of the way the frequencies were combined to bring a much more targeted and streamlined approach. I never intended to change the frequencies themselves. I knew we were just beginning to understand the multiple ways they could be used for the betterment of humankind. I did, however, discover that the frequencies could be patterned in new combinations to address challenging disease processes. My plan was to use them as a foundation to create new findings on how sound could be harnessed for healing. I knew that as more discoveries were found about how the human body works, then the knowledge of how the frequencies could be used would also expand. In 2016, I released the most successful protocols for use in the channels of the AMI 750 and named them the CIMA 10. Since my first visit with Dr. Manners in 2001 and following his passing in 2009, there have been great developments in the field of vibrational medicine. I have been able to take CIMA therapy to new heights due to the information I have gained from years of study and the knowledge shared with me by experts in many fields of endeavor. I can only imagine what Dr. Manners would say now, being able to see the healing power of sound accessed all over the world. With the utilization of his initial research and the new AMI devices now available to so many, I think he would be happy about the way the story has unfolded. From the time I was a child, I have had a deep affinity for the beauty of nature and the mystical symbols it can show us in many forms. My first spiritual teacher gave me the name Mandara, which is the name of a flower. Since then, I have had numerous experiences with seeing sound and observing it flowering. As a long-time meditation teacher, I had read many books about the healing power of sound. During this time, I discovered the work of Dr. Hans Jenny, who was really the first in the technological age to make sound made visible images. He named his study of wave phenomena cymatics. A short time later, I learned of a British osteopath, Dr. Peter Guy Manners, who was using frequencies to provide healing for the body. He named it cymatic therapy, out of respect for Dr. Jenny's work. Studying with Dr. Manners set me on a path to discover what could be accomplished with both the visual and auditory healing aspects of sound. After releasing my first cymotherapy device in 2005, I was on a search to find other scientists and researchers who could help me continue the exploration of how the frequencies could be used. Through a colleague, I learned of a British acoustics researcher named John Stuart Reid. He had invented an instrument called the cymoscope, designed to make sound visible. I was excited at the thought that I could take the healing frequencies I had received from Dr. Manners to John and see them made visible. This was something I had been waiting for since my discovery of Hans Jenny's work, even before I met Dr. Manners. I traveled to John's laboratory in the UK so that I could see for myself the amazing patterns generated by the frequencies from my sound healing device. What emerged from the cymoscope were some of the most beautiful geometries I could imagine. As I watched the waves of sound, I was able to see many patterns called cymoglyphs forming from just one of my healing codes. It was explained to me that while using this modern instrument, we are able to view a beautiful sound image that is flowering on top of the water, while another one is forming underneath. I carried the image and concept of sound flowering with me for many years. In 2017, John released this statement: "Sound patterns created by the cymoscope are literally the geometry of sound made visible. The perfection of these beautiful patterns are a natural manifestation of sound's vibration imprinting on the surface and subsurface of pure water. Whenever sound is present, patterns occur all around us and even within us as it imprints on the trillions of water-rich cellular membranes that make up the body, thereby emerging as a powerful healing modality." I knew from my early studies in India the importance of calming the mind, which I found could be done easily with soft gazing. This ancient technique, called drishti, worked beautifully when looking at the images of the healing sounds. The cymoscope images were easy to gaze into, just like the ancient yantras. Then, in 2016, my company, Cyma Technologies, began its collaboration with the Digital Worlds Institute at the University of Florida to create what I called the Sound Flower Experience. These sound visual meditations use images created by John Stuart Reid's cymoscope to give the viewer the amazing experience of being able to see and hear the healing sound. Modern scientists agree that engaging all the senses are necessary for a complete healing of the individual. Hearing and seeing the frequencies of the AMI Acoustic Meridian Intelligence device opens a new chapter in the way we heal the body, mind, and spirit. Then, in 2019, I released my first book entitled Soundflower: The Journey to Marry Science and Spirit. It had been my mission for many years to prove with science what I first knew to be true in my heart. I had certainly witnessed many discoveries in over a decade of researching the multitude of ways sound can be used as a healing tool. When I was deciding on the illustrations for my book, I knew that the most profound expressions of sound and the reflections of the beauty of my experiences would be the cymatic glyphs that have been such an integral part of my journey. Now I am able to enjoy many sound revelations. These innovative techniques have been extremely successful in helping the human race with the current stresses of modern-day life. Sound healing is helping us return to an inner world of peace, while the sound-made visible images allow us to have glimpses into a profoundly beautiful world that can inspire us all. I hope everyone will join me in the exploration of a cymatic universe. When you are researching the subtle bodies, you will soon discover that traditional medical measuring devices, such as X-ray and MRI, are not equipped to view them. My interest is in tracking how vibrational medicine tools can have a positive effect on the human energy field, particularly the impact of the AMI 750. In 2018, I discovered what is known as a polycontrast interference camera, which, with multiple filters, can view various layers of the human energy field. It can also allow the observer to witness the effect of any healing techniques administered to the human form in real time. In the past, with previous cameras, we could see snapshots of the energy field, but could never witness the dynamic human form in the moment, nor the immediate effect of any healing tools. An investigation with this camera begins by taking several baseline scans of the subject with various filters. Illness may appear as disturbances in the energy patterns of the subtle bodies in the form of a blockage or congestion. The polycontrast scans can aid in discovering a disease process. In some cases, it can actually point to a cause for the disturbance. In the second phase, the camera views the subject's responses, while an outside influence, such as a form of therapy, is applied. Vibrational medicine tools are utilized in an attempt to change or resolve the energetic pattern that may be causing symptoms or disease. With the polycontrast form of observation, you can see if the applied therapy is having an effect on the energy field and how quickly. With the earlier models of these types of cameras, I could witness the effects of my previous therapeutic devices, but I had never been able to conduct research to observe the effect of the AMI 750 on the whole body while applying sound transdermally through the bottoms of the feet. I was thrilled to find a practitioner in the United States, a qualified psychologist. She was well versed in the polycontrast interference camera and technology. She collaborated with me on a study designed to record the responses of participants, from those suffering with physical pain to those with emotional stress that had resulted in a disease process. A specific channel on the AMI 750 device was chosen for each participant. The new high-tech camera proved to be an amazing assessment tool. It was able to show the most minute changes in the subject's energy fields as the sound from the AMI 750 moved into their bodies. Even the psychologist who was conducting the study commented on their immediate, visible responses to the sound therapy provided by the AMI 750. I was able to watch as a person's pain disappeared. I saw how others' emotional stresses were easily shifted with sound. While observing all of this, I have never been more convinced that illness is often first visible in the subtle bodies. I believe the energy fields can be repatterned using frequencies so that not all congestion nor blockages will necessarily result in disease. After reviewing many of these cases, I believe the subject's experiences show how we can reach coherence, a harmony of the five bodies: physical, etheric, emotional, mental, and spiritual, resulting in our whole body healing. It is also no surprise to me that many of the scans showed an increase in the violet light in the participants' energy fields while receiving the therapy from the AMI 750. According to the evaluation offered by the psychologist, this color is usually associated with an opening of new energetic pathways. I believe that we are closer than ever to awakening to these connections through sound. Professor Sungjul Ji from Rutgers University and British acoustics researcher John Stewart Reed conducted a preliminary investigation for developing a protocol showing whether the lifespan of human red blood cells could be influenced by music. What started off as a promising experiment in December 2017 at the laboratory of John Stewart Reed blossomed into an amazing revelation for the therapeutic sound community. The first part of the experiment involved exposing red blood cells to classical music in an incubator for 20 minutes. A control vial was placed in a Faraday cage, an enclosure used to block electromagnetic fields during scientific experiments. When the cells were counted, there was a significant increase in the number of blood cells which had been exposed to the music. This initial phase led to an even more astounding experiment in June 2019. The first investigation had been conducted with only classical music. The June experiment was to include many forms of music, but this time, in addition to the music, a frequency combination called cell regeneration from Cyma Technologies was also included in the tests. The second phase focused on immersing human red blood cells in a specific sound sample for 20 minutes. The blood sample was decanted into 2 vials. One vial of the blood was placed in the laboratory music incubator, while the second vial was placed in the quiet environment of the Faraday cage. Immediately following this 20-minute period, the number of blood cells from each vial was tested using an automatic cell counter. Even though many different types of musical selections were included in this experiment, the most astounding results came from the test that used the cell regeneration code. The blood sample that had been exposed to this proprietary sound combination from Cyma Technologies showed 3,400,000 red blood cells per milliliter, while the vial that was in the Faraday cage, not exposed to the sound, showed only 920,000 red blood cells. The hypothesis is that the cell membrane can more effectively retain its integrity as a result of immersion in certain frequencies. While other musical selections also generated an increase in the number of cells, no other sound selection showed such an overwhelmingly positive response as the cell regeneration code. I was thrilled to report this preliminary investigation to everyone who is an owner of an AMI 750. The cell regeneration code is one of the most important ones we put in all of our channels. My personal hypothesis is that when our cells are placed in a sound environment, their ability to perform the cellular dance and maintain their optimum cycles is naturally enhanced. This is a great step toward the health and longevity we all desire. If you would like to read more about this groundbreaking experiment, you can do so on our website homepage under Cymatic Science News. In my study of Chinese medicine, I became fascinated with the teachings of how the teeth are connected to the organs through the meridian pathways. One of the most profound examples I saw of this was during a 2012 study that was utilizing thermal imaging to track inflammation in the body. I was reviewing a torso scan where there was an extreme inflammatory process in the breast tissue on the right side. As I looked at her health history, I discovered that the patient had tried numerous therapies to resolve her health issues. With her concerted effort, I wondered why there had been no improvement in the level of inflammation in her body. In looking at the scan, I also noticed extreme redness in the lymph area on either side of the throat. I thought it would be important to investigate where the lymph problem was originating. I invited this client to be part of a 6-week study using the AMI 750, Channel 3, which is known to reduce inflammation. We were using thermal imaging to develop a more in-depth study to include the oral and chest cavities. Her images revealed significant inflammation on the right side of the oral cavity. In Chinese medicine, this would be seen as a convincing correlation, as from the scan it appeared that the inflammation or possible infection in her oral cavity was directly connected to the inflammation in her right breast. After 6 weeks, with a total of 20 sessions with the AMI 750, we were able to see a measurable reduction in the inflammation in her breast and also in the oral cavity. This was accomplished with all sessions being administered through the portals of the feet, utilizing the meridian pathways. This inspired me even more to search for the causes of illness in the Sima technology case studies by utilizing the wisdom of Chinese medicine. This knowledge was helping me to understand why some people couldn't resolve their health issues with Western medicine alone. In recent years, modern researchers have begun to investigate how dental health issues can have a profound impact on overall health and well-being. There are actually more than 2,000 published studies which link infections in the oral cavity to bacteria found in the cardiovascular and respiratory systems, along with connections to many other degenerative diseases. When I looked closely at the average person's dental problems, it seemed that most common issues were chronic gum disease, the negative impact of dental procedures, crowns, bridges, and root canals that may harbor hidden infections. I wanted to examine how the AMI 750, which so effectively transmits sound along the meridian pathways, could be used to help alleviate dental issues and improve communication between the teeth and the organs. I knew that Channel 3, which diminishes the inflammatory process, and Channel 6, that supports the immune system, had proven to be very effective in resolving other health issues. I wanted to find out what their impact would be on common dental challenges. I began looking into cases involving subjects who had previously diagnosed dental conditions so that I could develop an effective AMI 750 dental protocol for at-home users, dentists, and hygienists. I wanted to see if there was evidence that chronic infections in the mouth had any correlation to infection in other parts of the body, as had been suggested in Chinese medicine and other Western medical studies. The suggested AMI 750 protocol was designed for a full 6 weeks. Thermal images were taken at various intervals to check the progress of the therapeutic sound sessions. For some participants, the thermographs were taken every 2 to 3 days, while for others it was at 3 and 6 week intervals. This method of tracking, which showed how effective sound could be in diminishing inflammation, proved to be astounding. Clients who had extensive dental work such as crowns, bridges, and root canals were finding that there were pockets of infection or inflammation that they were unaware of. After their sound therapy program with the AMI 750, the thermal images revealed that this innovative approach with Channel 3 was clearly diminishing the inflammation. The oxygenation of the cells with Channel 6 provided further support for the immune system. Other conditions were resolving after the full 6-week protocol with daily sessions on the AMI 750. With this important information, we could see how therapeutic sound could assist in preventing these dental conditions from worsening, and in some cases, even resolving the issue. All participants showed some level of improvement. The body is designed beautifully with the meridian pathways as the connecting rivers of life throughout. Whenever one system is challenged, the others in the body will reflect it in some way. Using sound to bring the systems back into harmony is very effective and can empower people to take their own positive steps until their oral health issues can be addressed or resolved. The AMI 750 provides a method for improving dental health and offers a great step towards prevention. From my first experiences in the temples of India, I knew that the power of sound was needed for the healing of the human race. The early spiritual adepts were using techniques to make sound visible with the sacred geometry of yantras, which were preserved in their paintings and carvings. In the modern age, we are using technology to make sound visible, resulting in awe-inspiring glimpses of the workings of the universe. Dr. Hans Jenny's Sound Made Visible images and writings on cellular structure brought clarification to my belief on how sound in its visual aspect can affect physiology. Said Jenny, the intercellular structures take the form of frameworks, networks, grids, and families of elements that continually repeat and follow each other in regular sequence. This phenomenon was witnessed so clearly in the early sound-made visible images he generated. His words guided me to a deeper understanding of how the body works in symphonic orchestration. We are attracted to outer beauty when the structure, down to the cellular level, is constructed in a poetic way. Sound organizes matter and creates exquisite patterns that we recognize. Some examples of this are found in the Soundflower experience. The realizations that I came to were from both esoteric and scientific studies. My first sound therapy teacher, Dr. Manners, shared with me his knowledge of cymatic therapy. But he was not a researcher, he was more of a clinician. He was highly intuitive, which became obvious when he was treating people, and he helped so many. While he didn't have all the research I needed, nor the explanation of how cymatic therapy worked, the combination of his therapeutic approach and Jenny's images comprised the full understanding of cymatics for me. Dr. Manners didn't need to see the sounds in order to transform the health of his patients. Yet, the modern-day cymatic glyphs are a form of confirmation of the beauty of the codes for us all. My search for truth began with the desire to see sound, like the ancient spiritual adepts. My heart's wish was fulfilled when I was able to see that sound could actually bring healing to the world. With the AMI 750 channels, I brought a new organization to the way we use the healing codes. When I was finally able to see what effect the AMI 750 was having on the human form, I felt that I had accomplished something important with the work of the sound pioneers that came before me. It is with great joy that I am celebrating the 10-year anniversary of the AMI 750. As the future unfolds, Cyma Technologies will continue to research the many applications of therapeutic sound. With our first 10 channels, we were able to offer solutions for specific health challenges and the tools to address the underlying causes of disease. The Cyma 10 will always be available for navigating your path to optimum health. I am also excited to announce that in the year 2022, we will release a new set of 10 channels which contain the foundation for the sound understanding of the human body. We have named them the Keys to Health. The new frequency combinations for the AMI 750 will pave the way for the use of sound therapy for disease prevention, as well as support of the body's most important functions. We will be able to avoid the health challenges that were often thought of as an inevitable process of aging. The keys to health will provide a means for the resolution of the causes of disease, resulting in vibrant health. With the use of the AMI 750, this becomes possible in our lifetimes. My hope is that everyone will continue to enjoy the limitless possibilities of the power of sound with the AMI 750. Thank you for helping me celebrate 10 years of surrounding the world with healing sound.